afternoon, everybody. I'm really pleased to see so many of you online this afternoon, wherever you are, whether it's noontime on the West Coast or 3 o'clock here on the East Coast. I welcome you. This is sort of a conversation that we wanted to have with our WomenHeart family, and I will kick off. I'm Celina Gorre, CEO of WomenHeart, for those of you who don't know me. I'm going to kick us off by just speaking very briefly about what WomenHeart is up to in response to the current COVID-19 crisis. And then I will introduce Dr. Rachel Bond, who is a cardiologist out of Dignity Health in Arizona, who's going to speak more specifically about the sort of interplay between heart disease and the current coronavirus crisis. And what I would recommend is, if any of you have questions, I believe at the bottom of your screen you have a Q&A button, and we're encouraging you to type in your questions, and then our team, our WomenHeart team, will be sort of giving us the questions to answer, and that'll be after the presentations are over. So without further ado, let's go ahead and get started. Go to the next slide. So again, I just wanted to give you a very brief overview of everything that we're doing so that you understand that WomenHeart has also obviously had to change the way it works. From a operations standpoint, as you might all guess, we are all now working remotely. Everyone is working from home, and we're also from time to time going into the office to pick up mail that comes through the door. We're also working with our vendors and our building to see where it might make sense to change our relationship, given that we are all working outside of the office. From a program standpoint, as you champions know, we've suspended all in-person activities. And we are working to scale up all virtual work. So some of you were on a webinar last week on Thursday that Brittany Walker presented, which was really to help you on the technical side in terms of how to run a virtual support network meeting. And then the next thing is we're trying to accelerate the launching of the Sister Match app, which all of you will have also heard about. In fact, we were on a call this morning with the developers of the app to get it, to expedite the development of it so that we can get it into the hands of women with heart disease around the country. And then we're also wanting to give folks who have to stay in their homes something to do and something meaningful to contribute to women with heart disease across the country, and that's sort of to bring to have you and to encourage you to knit the heart scarves that most of you will be aware of. On the development front, we are working closely with our funders to focus our programming and our bringing in of funding programming wise on the Taking WomenHeart virtual. And we've gotten really good feedback from our funders, and I listed a few there. We're also looking at re-establishing our WomenHeart Future Fund, as well as working with our board to encourage them to get much more engaged on our fundraising efforts there. Next slide. And then lastly, I'm not going to go into a great detail about this, but as you can imagine, legislation is coming out fast and furious from Capitol Hill. And we are very lucky to be working in coalition with a number of other patient advocacy groups. And we're looking very closely at the legislation, the various bills that have been coming through, to make sure that women with heart disease are also considered. And in some cases, particular high-risk groups like pregnant women and others who need special consideration. everything from, from the provision of the COVID-19 test to making sure that women who are pregnant are included in research studies when it comes to looking at vaccination and treatment for COVID-19, and making sure, again, that as an organization, as a nonprofit organization, our organizational needs are considered when Congress is developing bills for financial relief packages for organizations. That's just a snapshot of the various legislation that we are advocating for. So that's it from my side. I'll hand it over to Dr. Bond now to really get into the meat of what you all are probably wanting to hear about today. And then, like I said, if you have any questions for me, please type it in the Q&A section, and then we'll come back to it once the presentations are done. So let me hand it over to Dr. Bond.
Thank you. Thank you so much, Celina. So I first just want to actually just introduce myself. So I am a general cardiologist. I am the medical director for the Women's Heart Health Program at Dignity Health, and I am board certified in not just cardiology, but also internal medicine. So this is an area that I think all of us, it's such an important area that all of us have to have a better understanding on, because not just the healthcare workers at the front line are really helping to sort of mitigate the spread of this virus, but also you at home or even staying home are helping to allow us healthcare workers to help mitigate this virus. So I thought it would be important in particular because we know that in order for you to understand what your risk of having this virus is, you have to first understand what the virus is, what the symptoms are, and what you can do to help not just us healthcare workers, but your entire community. So I thought it would be probably beneficial for us to give a little bit of an overview of what COVID-19 is, or the coronavirus, and then delve into any of your questions and answers that you may have. So just to begin, what is COVID-19? So when we think about the coronavirus in general, we know that it's very common. In fact, many ordinary colds are caused by it. The reason why the coronavirus disease 2019 is called COVID-19 is not per se because there are 18 other coronaviruses. There are actually thousands and thousands of coronaviruses. It's because it was first brought to the attention in the year 2019. And what makes the coronavirus or COVID-19 a little different than the general coronavirus that leads to the common cold is that it's mutated. And because it's mutated, it's much more virulent or dangerous to our body, and it's new. So our bodies have not actually had exposure to it. So we haven't had the ability to mount what's called an immune response, or a way for our body to fight off this infection. And it was first reported in late December in China, December 2019, where then the first documented case came to the United States in January 21st of this year. The state of Washington was actually the first state. And it was really classified not until early March of 2020 by the World Health Organization as a pandemic, which really implies that it really spans the outreach across the globe. We know now that it's in every entire state in the United States, and in particular, with respect to the pandemic, I can say that we as a nation have been responding. We've since closed schools, conferences, public events, and locally hospitals are having much more tighter restrictions with respect to who they allow to enter the hospital and with respect to hospital visitations. And I think that's so important because, like any virus, the way that we spread it and the way that we can get infected is by touching one another, because it's droplets. Anybody who coughs or sneezes and touches their hand doesn't wash their hands or wash their extremities, have the ability to infect another person. If we can go to the next slide. So it's important for us to understand that there are common symptoms when we think about COVID-19. For the most part, and I want to preface this by saying that because this is such a new virus, we're rapidly learning about new symptoms and signs that may be arising day by day. But the more common symptoms, which really lead to the mild disease that occurs in about 80% of the population, is a cough, is a feeling of fever. If you feel you have a fever and or if you have a documented fever above 100.4 Fahrenheit or 38 degrees Celsius, as well as shortness of breath. What's important to understand is that these symptoms can occur actually 2 to 14 days after you've been exposed to somebody who has had COVID-19. And that's where that sort of quarantine period comes into play. And these are words you've probably heard throughout the news and on the media. And I'm going to talk to you about what's the difference between social distancing, quarantining yourself, and self-isolating. But what's important is that there are other symptoms that we're now noticing that are also mild and you have to be aware of. So a lot of these symptoms could be things that you experience with a normal virus, such as body aches, you may feel tired. You may also notice, more recently, we're noticing that people sometimes express a loss of taste or a loss of smell. It may also, like many viruses, have a loss of appetite, and it may actually cause a lot of stomach upset, such as diarrhea. So if you have any of these symptoms and you're not sure if you've been exposed to COVID-19, the most important thing to do is, one, you don't have to go to the hospital because these symptoms are mild, but call your general practitioner. And in the interim, while you're getting guidance from your general practitioner, I think it's important that you self-isolate. What that means is really go within what's called a sick room, meaning a room that's just for yourself, so you're away from your family and loved ones in the event that they may have exposure to this as well. What I again want to emphasize is that these are the milder symptoms, that 80% of what we're seeing in the general population, and these are the mild symptoms that we know that you're able to sort of overcome either through rest and hydration, so staying home with these symptoms where you don't per se have to be hospitalized. If we can go to the next slide. Now, when do we have to actually seek medical attention? And these are the more severe illnesses, which does affect a subset of the population, because we know that this virus, being very virulent, can actually affect the organs, all of our organs in particular. It could lead to a serious case of pneumonia. It could lead to something called sepsis or septic shock, where your blood pressure is very low, and you need medications to help sort of get you through that and make your blood pressure a little bit better, so it provides more blood supply to your vital organs. But when should you worry about when to seek medical attention? It's if you're noticing you're having trouble breathing, if you're having a persistent pain or pressure in the center of your chest, or really in your chest all over, if you're having new confusion or inability to arouse yourself, and if you're noticing that your lips are becoming more bluish or your fingertips or face are becoming more blue, that usually is a first sign that your oxygen levels are rather low. And many of you on this call probably are women or men who have heart disease, and you probably are wondering, well, these are a lot of symptoms that I experience with heart disease. And what I want to express is the fact that we as clinicians are noticing that many patients are presenting now with exactly the same symptoms that I'm enlisting, which are severe illnesses, such as trouble breathing and pressure in their chest. And we're also noticing that they're having changes on their electrocardiogram or EKG, which allows us to see how well the electricity is running through the body. And a lot of those changes make us think that the person is having a heart attack, where perhaps there's even 100% blockage in one of the arteries of your heart. But what we're noticing is that when we do take them to the catheterization lab and do what's called a coronary angiogram, where we look to see if there's any blockages, their arteries are either normal or mildly diseased, but what we're diagnosing them with is COVID-19. And what we're noticing is that it's actually mimicking that of a heart attack. And it's because the virus, like many viruses, not only can attack the heart muscle, but it can also attack the arteries, particularly the little tiny arteries, or what we like to call the microvasculature. So the important thing, what we as doctors, cardiologists right now are doing is, if we have anybody who's presenting with these symptoms and has a fever or any other identifying evidence that perhaps they have an infection, we're taking a thoughtful pause before rushing them to the catheterization lab and deciding, should we rule them out for COVID-19 to ensure the safety of the healthcare workers around us, but also the safety of the patient. So if you're experiencing any of these symptoms, the first thing you want to do is seek medical attention. And when you are seeking medical attention, if you're not calling 911, you're probably going to want to call the hospital ahead of time to alert them that you do potentially have a fever, you may have been exposed to somebody with COVID-19, and you have a lot of these more severe illnesses, and that way they can prepare for you accordingly. If you can go to the next slide. Now, we know that those that are more likely to have severe illness are those that are deemed high risk. So it's important for you to understand who is actually thought to be high risk. And we know anybody above the age of 65 is considered high risk. The older, the higher the risk. We also know anyone living in a nursing home or long-term care facility. A lot of that has to do with the fact that, again, this is a virus that's spread. And when you're very close to somebody, as you usually are in nursing homes, you have a much more easier way of spreading it. So you want to ensure that you have that at least 6 feet distance, which we'll talk about what this 6-foot rule is. But honestly, anybody at any age with high-risk conditions can experience these severe illnesses. So that is anybody who has heart disease, particularly heart disease with complications. We know chronic lung disease in particular, including asthma. Anybody who's immunocompromised, either it be because they're on chronic steroids for other medical reasons, or if they have an autoimmune condition, particularly if they're on cancer treatment, that does make them immunocompromised. We also have studies coming out, particularly in Italy, that show those with severe obesity at any age actually places them at a higher risk of potentially having the severe form of this illness. And that's anybody with a body mass index above 40. A body mass index allows us to look at your weight compared to your height, and anybody above 40 potentially is a risk factor. Anybody who doesn't have a good control over other medical conditions such as diabetes, kidney disease, or liver disease. And I place pregnant women at the very bottom with an asterisk because right now, again, this is an evolving virus and we're really trying to follow what the CDC is recommending and providing guidance on. And we know that particularly during pregnancy, not only is it a stress on your heart, as well as other vital organs, particularly if you have some pregnancy complications, but we know that it also can lower your immune system. So it's for that reason the CDC is recommending that we treat pregnant women with the same precautions as those that are in that high risk category. If you can go to the next slide, please. So if this brings the point of, well, should I be tested, particularly if I'm in that high risk group? And I think the easiest way to kind of go through this is to look at priorities. And this is really guidance from our state, particularly as well as our government. And again, it's going to be dependent on your local states, what they have mandated based on how many cases of COVID you have. But for the most part, we're trying to focus in more on the first priority group as well as the second priority group. So the first priority group are any patient that's hospitalized with symptoms, as well as any healthcare worker who's hospitalized and or who's symptomatic, I should say, because we know that that healthcare worker is at a high risk of actually having contracted the disease. Our second priority group are patients in that long-term facility, such as a nursing home, where they may have symptoms. We also know that anybody with underlying conditions, those high-risk conditions I just discussed, including heart disease, who have symptoms should be tested. We also know that our first responders, such as our ambulance and our EMS workers with symptoms, should be prioritized. So really the theme of this is anyone with symptoms, and that's really where we have to understand right now that we have limitations in the number of testing that we have. I can say that the FDA has loosened their ability to have private organizations create tests, and with that, we're hoping that we'll also have a test where you can check if you have had exposure to COVID-19 at home. But until we have a surplus of that, we really want to ensure we save these tests to really the priority 1 and priority 2. In the event that we have a surplus, then we can consider, and also the resources, we can consider focusing in on priority 3 group, which are the critical infrastructure workers with symptoms, any individual who does not meet any of the above categories with symptoms, healthcare workers and first responders, because again, they are at high risk of having exposure, and any individual with mild symptoms in the community, particularly in communities where we know there are high COVID-19 hospitalizations. And then once we get to the non-priority group, which are individuals without symptoms, that's when we would have a surplus of these tests. And the way that we perform this test is actually through a nasal swab. And we send it out at this point in time, and we tend to get the results back within 2 to 4 days on average. But again, they're focusing in now on more rapid testing that it will allow us to get it back within minutes, if not hours. If you can go to the next slide, please. So why is this important, and what can you, as somebody with heart disease or a loved one with heart disease, actually do to help prevent the spread of this virus? One thing is, and I really like this graph, which I borrowed from a colleague at NYU, Dr. Eric Kutcher. He actually references from the New York state government website, where he separates what is the difference between social distancing, quarantine, and isolation. And particularly any person who has heart disease, you fall in that high risk group. So you should really be practicing social distancing. And what does social distancing entail? It does not entail that you have to wear a mask. What it entails is that if you work, you probably should try to work from home, particularly if you're a non-essential worker. So speaking with your job to see if you have the possibility of working from home. It's also okay for you to still go outside and exercise, go grocery shopping, but you want to ensure that you're maintaining at least a 6-foot distance from anybody next to you to prevent any exposure, as well as prevent any spread of possible disease or infection. The time frame for this is really indefinite, and that, of course, is based on your local legislation, but it's really more importantly going to be until this pandemic resolves. When we talk about quarantine, quarantine is when you feel you may have been exposed to somebody who had the virus, but you're not experiencing any symptoms. And it's important that if you feel you were exposed in that situation, you may want to consider wearing a mask, particularly if you're around other people or if you're leaving your home and going outside. And the mask is really the cloth mask, really a face mask. And I'm going to talk about the different types of masks because it's imperative that you understand, particularly us healthcare workers, there are limitations in the personal protective equipment. And we want to ensure that we leave the personal protective equipment for the healthcare workers on the front line. So using a general cloth mask, particularly if you're in the quarantine state, may be okay. We also know that going out to grocery shop and exercise, particularly if you feel that you were exposed to this, is really discouraged. And we want to make sure that you're quarantining yourself for 2 weeks, at which point you then can go back to your normal day-to-day activities. But really go back to social distancing, which is what we, I think, as every American should be practicing right now. Then what about isolation or self-isolation? That's when you're actually symptomatic or sick. And in that situation, you should absolutely wear a mask, especially if you're in contact with anybody. You want to ensure that you have a sick room in your house, meaning that that's the room you sleep in, that's where you spend most of your day. You want to ensure that you absolutely don't go to work. You don't want to go outside as much as you can, particularly at all. And you don't definitely want to exercise outside, but utilize the luxury of your home. And in this situation, the CDC suggests once you are symptomatic, you should at least stay isolated for up to about at least 7 days, but you need at least 3 consecutive days of having no symptoms before you can go back to social distancing. So hopefully that sort of made it a little bit easier for you to understand the differences, but really in summary, any person who has heart disease really should be practicing social distancing. If you can go to the next slide, please. So we talk about personal protective equipment, and I think really I wanted to separate this into community versus healthcare worker to put it into a big perspective. So if you can just pause for a sec, go back. You can go back. Yes, thank you. So with respect to the community, as I said, if you're in quarantine, wearing a mask in particular should be okay. And that mask could be cloth, but there's questions of if we even in fact truly need that. And there's some that would suggest if you're in a quarantine period, absolutely. But if you're social distancing, there's really no need for that cloth or face mask. We want to make sure that we maintain it for our healthcare workers. But what about our healthcare workers? And if we could advance the slide now. Now, one thing that the CDC said, which for me as a healthcare worker was rather discouraging, was being that there will be a shortage, and we anticipate a shortage, and we're already seeing shortages in several states of personal protective equipment, you can utilize a bandana to protect yourself while working in the front lines of taking care of patients that perhaps have COVID-19 or have been exposed to this. This, unfortunately, is something that I think really is discouraging, because we know that this bandana is not protecting our healthcare workers at the front line. If you can advance the slide, what actually is protecting our healthcare workers are these personal protective equipment. So gowns, gloves, and in particular, if you advance the slide, the N95 face mask. And we can see it very nicely here. What is different between the N95 face mask versus the general cloth face mask is that 95% of the particles will not penetrate it, including viruses. So we have the ability to protect this, but we want to stress, or at least I want to stress, that that equipment really, really needs to be left to the healthcare workers, particularly the healthcare workers that are at the front lines, and not per se the community, because we have limitations in terms of these personal protective equipment. If we can go to the next slide. So specific to heart patients, what are other measures that you can do to kind of help prevent the spread, as well as help prevent yourself from becoming infected? So we want to first defend against the infection. You want to avoid any sick contacts. You want to wash your hands thoroughly with soap and water for at least 20 seconds. You want to use the inside of your elbow, for example, right? If you're going to be coughing or sneezing, you want to avoid touching your eyes, your nose, your mouth, and you want to ensure that you clean surfaces touched very often, such as doorknobs or steering wheels. And again, you want to really enforce that six foot rule, trying to stay 6 feet away in distance from anybody in particular that may be next to you. We want to ensure you're also getting vaccinated. So right now there is not a vaccine for the coronavirus. They are steadily looking into this, and they have expedited several trials in particular. So hopefully we'll be hearing some good news about a vaccine coming out. We are testing it in a few states right now. But more importantly, there are vaccinations for other conditions that you are at also a risk of getting, such as pneumonia and the flu vaccine. Specifically, if you have heart disease, we know that you should make sure that you're up to date with your pneumonia vaccine as well as your flu vaccine. You want to also encourage your providers or your general practitioners or even your cardiologists to think about using telehealth visits. This is, I think, huge and monumental, because we want to prevent you from having to sit in a waiting room with other people in the community waiting for your doctor, particularly if you're only going to see your doctor for, let's say, a medication refill, for example. So this is the beauty of the internet right now, where you can use websites and other venues, or even over the phone, to have a conversation with your general practitioner as well as your cardiologist to see if perhaps you don't per se have to go in for a visit. So thinking about talking to your healthcare clinicians about telehealth is so important. And then more importantly, we want to ensure that you're keeping up healthy habits, right? So we want to make sure that we stay with our same routine. If we're social distancing ourselves and trying to stay at home as much as possible, we do want to get dressed. We perhaps don't want to stay in our pajamas all day, right? We want to ensure that we're doing everything that we were doing before, utilizing exercises from home, making sure you're eating a healthy diet, and more importantly, making sure that you're managing any stress you may be experiencing. Right now, I think stress is in the entire population globally, right? I mean, the first thing we have to do is understand that stress right now is normal, and it's normal to be anxious about this. And what I think is more important is understanding if we are dealing with this stress in a productive manner or a non-productive manner. So a productive manner of dealing this would be really to kind of fuel yourself into something actionable, such as maybe a lot of what Celina talked about through WomenHeart, utilizing the virtual support group, or even thinking about perhaps knitting, for example. I will touch upon a few things that my own WomenHeart group is doing here locally as well to help healthcare workers once we sort of get to the end of this, but that would be a healthy, productive way of dealing with your stress. A non-productive or unhealthy way would be perseverating on what's going on and the unknown, for example. And things that we can do to help prevent that is to maybe avoid looking at too much of television, or really honing in on really sort of things that can help you really focus on your mental health, again, such as exercising at home. That releases endorphins, which are natural hormones that our body produces that makes us feel more relaxed and happy. So it's very, very important during this time period that we're doing that. If you can go to the next slide, please. So a lot of patients have asked me if there is treatment for COVID-19, particularly if you were symptomatic from it. And as I stressed earlier, 80% of the time, you're going to have mild symptoms, and all you're actually going to need is to rest as well as hydrate yourself. So you want to be cautious, of course, with respect to hydration if you have heart failure, and that's where having a conversation with your general practitioner comes into play. For those that are hospitalized and critically ill, I label it as experimental options because these have not been formally looked at in large studies, but they're looking at them right now to date. And this again is on a case-by-case basis, but the FDA has approved the use of something which is called convalescent plasma. What that is the liquid products of our blood. We sort of extract that from anybody who has survived the coronavirus, because the likelihood is that product will have an antibody that can protect somebody who may be experiencing symptoms. So this is the way that we actually create vaccines. So this is something that is FDA approved in very, very critically ill patients. Additionally, there probably has been a lot of buzz about hydroxychloroquine or chloroquine, as well as the use of azithromycin. This was more so based on a study that was looked at in France, where they looked at a very small number of people that had symptoms, and they were given both medications. And what they saw is that there was a reduction in the number of viruses within the body. So something that we call the viral load. What it didn't look at was there any clinical benefit, meaning did their symptoms go away quicker, or did they perhaps not have any terrible outcomes from that? And that's something that we're looking at now in the United States. But I think that perhaps hydroxychloroquine may show some promise, but again, you want to speak to your general practitioner as well, just to make sure before even thinking about starting any of these particularly medications, because these medications were really encouraging for those that are critically ill. Antivirals as well, this most recently had been FDA approved for patients for what we call compassionate use, meaning anybody who's critically ill, not recovering from any of the other measures that we talked about. And this medication is remdesivir, which was originally looked at during the Ebola crisis that we were dealing with. And more importantly for you particularly as heart patients, is what do we do about your current medications? And I can't stress this enough. If you are taking any medication for a health condition, including heart disease or diabetes, problems may occur if you skip a dose or stop it altogether. So you don't want to change your medications or treatment without first talking to your healthcare professional and ensuring you have a large supply of these medications. Now, one medicine that has also been in the news is ACE inhibitors or ARBs. These are medicines that we tend to use for blood pressure control, or even if you have a weakened heart muscle. Examples of this are lisinopril, ramipril, losartan, valsartan. From a few studies in China, there was a question if the use of these medications were dangerous because it could actually cause patients to have a more severe illness from COVID-19 if they had exposure. And we know that that is actually disproven. And right now, what we are encouraging is if you're on these medications in particular, you continue them even if you have mild symptoms of the disease, of the virus. We would never start these medications, however, on anybody who's in a critically ill state, meaning very severe illness. So we would wait at least until they've overcome that illness before even considering starting them on an ACE inhibitor. But we're not encouraging patients to stop this medication, particularly if you've been on it and it's been helping your blood pressure as well as helping your heart muscle pump better. If you can go to the next slide, please. So I think this is probably the most important slide, or one of the more important slides, is when to avoid the hospital. And the easy answer to this is at all costs, so all the time, because that is really the area where you're going to be have the highest risk of having exposure. So we want to limit hospital visitations, and I can say that local hospitals have provided restrictions, and you want to focus in on what your local hospital says. If you have a family member or loved one that is hospitalized for COVID or another condition, particularly if you have heart disease, you may want to consider using more teleconference approach to talking with them, either through FaceTime, for example, or WhatsApp virtually. Additionally, I wanted to hone in on elective procedures, because as cardiac patients, you may have a lot of these elective procedures like echocardiography, a transesophageal echo, which actually allows us to look at the structure of the heart through the fluid pipe, a stress test even, any elective cardiac catheterizations, including if you had a blocked artery that you knew about for several months now and you were planned to have that artery open. Additionally, any peripheral interventions, meaning blockages in the arteries of your legs, the use of a Watchman device, which typically we utilize for patients that have atrial fibrillation, which is an irregularity of your heart rhythm, and that could put you at a higher risk for stroke. And if you have atrial fibrillation and you're not able to tolerate a blood thinning medicine, sometimes we use a Watchman device, which closes off an area of the heart that tends to be higher risk of having clots form. However, during this sort of pandemic, these are procedures that are more elective. And again, we want to focus that this is on a case-by-case basis. Even the use of a mitral clip, which we tend to use for patients that have a very, very leaky mitral heart valve. Similarly, transaortic valve replacement, which we use for patients that have a very, very tight aortic valve. This will all be on a case-by-case basis, and it's very important before your elective procedure that you call your doctor and decide, is this essential for me to do, or is this something that I can reschedule? Because by doing that, you're going to be helping us prevent the spread of this. If we can go to the next slide. So I wanted to end this by really, hopefully, allowing you to understand that you are helping. You really are. And I wanted to emphasize how you can help more. And I can't emphasize enough that by staying home, you are helping to prevent the spread of this pandemic. So please stay home if you can, particularly if you have heart disease. You want to encourage the use of particularly social distancing as much as possible. So how do we do that? Avoid non-urgent travel in particular. You want to avoid social gatherings in groups of more than 10 people. And these are CDC recommendations. You want to, again, reinforce everyday prevention, such as washing your hands and making sure that you're staying away from anybody who in particular may be sick. You also want to consider donating either money, supplies, or your time. And I want to use this as a time, I think, to even highlight my WomenHeart support group in particular. So one of my WomenHeart champions, who's our lead champion, Carol Hostever, she had reached out to me to talk about, particularly if the ladies that are within our support group and also her local friends, if they can help in any way by producing cloth masks. And I had reached out to our foundation, the Dignity Health Foundation, and we thought it was a marvelous idea, because while they are doing what they're told, which is really trying to stay home as much as possible, they're using this time to not just knit the red scarves, but also consider the use of cloth masks, which, although, as I said, are not as effective as the N95s, they're still providing some form of protection for the community as well as our healthcare workers. So these are really things that I think that are encouraging. And if we can go to the next slide, where we're going to open it up for questions, I'd like to leave you with just sort of a few comments that I think as a community, we should all really think of ourselves as perhaps having the virus. That way we're going to be more attuned to the fact that social distancing is so important, and really ensuring that we sort of stay 6 feet away from one another or wash our hands as regularly as we can, and really enforcing, I think, focusing in on mental health, exercising, utilizing all of the wonderful support from WomenHeart with the virtual support group, even locally thinking about helping by knitting the scarves, or if you want to also do something very similar to my support group in Arizona, thinking about the use of cloth masks, that's one way. So I would love to open it up now for any questions or statements. I think we have a few actually. And let me see where we should begin. So the first question is, heart disease is a very broad term, and this was from Kathy. Are there particular types of heart disease that are lower or higher risk, such as heart failure, arrhythmias, high blood pressure? Thank you. Yes, and I think that's an excellent question, Kathy. The reason it's an excellent question is because we know that particularly patients that have severe forms of heart disease, so anybody that has had the need for, let's say, a stent, open heart surgery, anybody who has a weakened heart muscle, they are going to be at a much higher risk than somebody, for example, that has elevation in their blood pressure, particularly if their blood pressure is under control. if you saw in the slide, I emphasized that there are a lot of medical conditions that put you at a higher risk if you don't have good control over those medical conditions. So you're absolutely right to say that it's really the heart disease with complications or the severe forms of heart disease and not all heart disease as a whole. So if you have elevated blood pressure in particular, but your blood pressure is under good control, you don't fall into that high risk group per se, but I would encourage you again to really think about practicing social distancing in that situation, irrespective of that. The next question also came from Kathy, which is, you suggested that we ensure we have a large supply of our medications. Are insurers in agreement with this? I know of an instance where the individual wanted to stockpile some additional insulin, but the prescription drug company would not fill any additional prescriptions. Can our doctors help intervene? And this is such an important question, and you're absolutely right. It's really based on your insurer. I think right now it's too early for us to say if the insurance companies were gonna loosen up several of these restrictions, and there are going to be situations where you're not going to be able to stockpile as you made mention of. But in certain insurances or in certain situations, us physicians can try to help, particularly if we think that it would be in your best interest to have a larger supply. I think it doesn't hurt to reach out to your general practitioner and ask them if they would be willing to speak on your behalf over the phone to the pharmacist and or the insurance company to see if we can provide you with at least perhaps a 3-month supply. Luckily, there are a few insurances that prefer the use of a 90-day supply over a 30-day supply, for example. So that hopefully answers your question, but you're absolutely right. Right now, there's not a mandate for all insurances to allow a surplus or a stockpile of medications. Now, Susan Smith asked a question. Her husband, who's 68, has no health issues, wants to go out. He says to drive through car wash. This seems fine to me. The heart patient from, this is from Susan in Tucson, Arizona. So your husband, based on what I'm understanding, is 68 years old. So he does fall into that high risk category just because of his age, irrespective of the fact that he doesn't have any health conditions. And what I would encourage him to do, because he falls into that high risk group, is to really practice social distancing. So he absolutely can go out. However, I would encourage him, if he is going out, to make sure that he's maintaining at least a 6-foot distance from anybody. Staying within the car likely will be safe. You want to ensure that when he does get home that he cleans his hands, he washes his hands, he doesn't touch his face, and that he really does the precautions that we do that are implemented or encouraged by the CDC, and particularly for those at highest risk. I would suggest, however, that he try to ultimately decrease the number of times he does go out and think about not doing any non-essential things. If a car wash to him is very important, and perhaps he can limit it to maybe once a month as opposed to how much more regularly he used to do it. But I would encourage really trying to limit as much non-essential outside communication or going out as much as possible. Another question that someone asked is, how long does COVID last on average if you do test positive? So if you do test positive for it, we know that at this point in time, if you test positive but you don't have symptoms, meaning that you were in that exposure range, we are suggesting you sort of quarantine yourself for 14 days because that's really the life of the virus right now. We know that COVID in particular on surfaces can last for up to 72 hours, and even airborne, it could last for 8 hours. And that's why that social distancing is so important in making sure you're at least 6 feet away from somebody. However, we know that particularly if you test positive but don't have symptoms, the CDC guidance is 14 days of quarantine. If you test positive and have symptoms, it's at least 7 days, but we want to ensure that you're not having any symptoms for 3 days consecutively. Now, another question is, there's so many questions, which is wonderful, if someone is coughing, Is it true droplets of COVID-19 can stay in the air for 2 hours? It's actually up to 8 hours that it can stay in the air. It is absolutely true. And that's why there's an importance of making sure that you are doing that 6-foot rule. If someone is coughing, I highly encourage you to make sure that they're coughing within their elbow, or if even if they're sneezing, and make sure that if you are around them, or if they are having any symptoms and you have a cloth mask, it may be beneficial to ask them to wear the cloth mask, or at least make sure that you maintain your distance of 6 feet. Agnes, my former wonderful WomenHeart patient from New York City, so informative. Any additional precautions we can take in high density areas such as New York City? I can say that I have been following what has been going on in New York City. I do think that the governor is providing wonderful guidance every day, ultimately in terms of what is best practice. But in New York City right now, particularly for heart patients, we know that you have the highest numbers. There's over 30,000 cases of positive documented COVID. And just to put that into perspective, the second highest state is New Jersey, where New York has almost 10 times the number of positive cases than New Jersey. And a lot of that has to do with the fact that New York, and particularly New York City, is so closely knit. A lot of it also has to do with the fact that they tend to have people coming from all walks of life. So right now, I think from a local level, what New York City is doing is they're trying to contain this as much as possible. And the way you can help contain it is to really stay as much as you can and enforce social distancing. Again, what that means is if there's any non-essential things that don't require you to go to, really limit that. If you can work from home, please work from home, particularly if you are in that high risk category, such as heart disease, because it's so imperative and so important. So I think you are helping definitely to mitigate the spread, particularly in New York City, just by doing and practicing those measures. Another question from Mara Robin: is there a time period in regards to how long the sickness typically lasts with the mild cases and also with the more severe cases? So I think that right now your question is very actually important and informative, and I think right now we are learning each and every day more and more about this disease. What I can say is that for the most part, it's really on a case-by-case basis, because even those that may have more severe symptoms may recover from the more severe symptoms much quicker than somebody who doesn't have as severe, who doesn't have, let's say, as severe symptoms. So I think that it really is on a case-by-case basis. And in particular for mild symptoms, if you are symptomatic, we want to reinforce that you want to isolate yourself for at least 7 days, and you want to make sure that you have 3 consecutive days where you have absolutely 0 symptoms or no symptoms altogether before you go back out and do more social distancing. Now, another question comes from Jackie B. She has asked, mom's doctor will now be sending mobile person to check INR versus going into the office. Wouldn't it be better to buy a meter and test it at home to avoid contact with another person? Well, I can say that that's a very excellent proposal and a very excellent point. One thing that you want to ensure is that that meter is actually effectively working. And that's something that I think you can definitely talk to your healthcare provider or clinician about, to say, well, if I have my mother come in and they check her INR, is there a way that we can test the meter that I'm willing to buy? Because you're absolutely right. I think that if we can limit the amount of exposure, then you are helping us as an entire human race sort of really limit the spread of this virus and sort of limit this pandemic. So I think that's a very wise suggestion, and something that I would definitely encourage you to talk to her general practitioner about. Another question is, Sharon Bonds. Hi, Sharon. This is a survivor from New York City. We have any of the symptoms and have to call into the ER. Should we tell them that we are a heart attack or heart disease survivors first? An excellent question, Sharon, and you absolutely should, because you fall in that higher risk group. So if you have had a history of a heart attack, had a history of any form of heart disease, particularly a weakened heart and muscles such as heart failure, when you are calling in, it would be important to let them know your history, a brief history. That way they can know that you're in that higher risk group and your sickness may mean that you're going to have a much more severe illness than somebody else. Another question from Eileen Martin is, do we have a corporate number to use for support meetings on conference calls? I'd like to do one for April. Perhaps we can get Celina to answer that question. If there's a general number for the virtual support groups.
Yeah, thanks a lot, Rachel. So yeah, what you need to do if you would like to run a virtual support network is contact Morgan, who you all know. And we have been running meetings or supporting women who want to do that. So if you know how to use Zoom, then great. That's the platform we're using, like we're using now. And if you don't know how to do it, then we are more than happy to help you set that up. Thanks for the question.
Okay, perfect. So another question was, is it okay to allow workers in your home, example, house cleaners? I can't stress enough the fact that we really should be encouraging social distancing. And again, we really should all be thinking that we have the virus, and that's the only way for us to put it in our minds to say that we should distance ourselves from these non-essential needs. And I would suggest personally that any house cleaner, any worker in particular, at this day and age, we probably should discourage them from coming to the house, because they are not only putting themselves at risk of potentially contracting this virus, but also you're putting yourself at risk of potentially contracting the virus from them too. Another question comes from Lynette. If the virus stays in the air and you walk through it within the 3-hour period, it stays active, even if the person that coughs is no longer there. Can you catch the virus? And the answer to that is yes. So it stays airborne for up to, it stays airborne up to about that time span. It's actually a few more hours, but even if the person is not there, you can catch it because it's already been exposed. So if you feel that you have been in contact with anybody that has had COVID-19, either documented through a test, or if they had symptoms of it, you probably are going to want to put yourself in quarantine, which means that for 14 days you're staying home, not going to work, and encouraging the use of hand hygiene. Another question comes from Rena. I was diagnosed with PVC 7 years ago. I'm not on any medications due to only having flutters, extra beats, very far and few in between. My recent stress echo was great as well. Is there anything I should be conscious of? Thank you. So you in particular would be somebody who is not falling in that severe heart disease range. Nonetheless, I don't know what your age is in particular, and if you had any of the other risk factors that may put you in that higher risk category, but I want to encourage that irrespective of your age right now, we all should be enforcing social distancing as much as possible. I sound like a broken record, but it's so important in order for us to kind of make sure that we prevent the spread of this virus. Another question is coming from Nancy Holland. Are there other bad viruses going on right now? It's not flu, tested negative. Is it likely COVID? So you're right. We have so many viruses out there, and I don't want you to think that if you have symptoms, automatically it's COVID-19. And for the most part, there are other viruses out there, such as viruses of the stomach, viruses of the upper airways. And that's why it's important that if you have any symptoms, you discuss this with your general practitioner, because they will help guide you, particularly because they will know locally what is the status of testing in your area, and also if you're somebody that should be tested or if you're somebody that should quarantine themselves or isolate themselves depending on if they have symptoms. Another question from Just Me is, when are pandemic restrictions lifted for us over? When curve starts dropping in 2 to 4 months, and when no new cases. This is really something that the NIH and the CDC are going to help guide us with. Right now, there's really no, I can say, in the near future, I think any restrictions that are going to be uplifted or should actually be uplifted until we have a better containment of this virus. So until you hear anything from our the NIH and our federal government, for example, I would really enforce practicing social distancing as much as possible. Another question comes from Mara Robbins. Should I be taking my temperature daily during this time? Unless you are somebody that falls in that high risk of exposure. So this is more so what a lot of hospitals are encouraging their healthcare workers to do right now, because they have full exposure, a higher risk of exposure than the general population. So as somebody in the general population, no, You do not have to check your temperature on a daily basis. The only time you really should be is if you're noticing any of the other signs or symptoms, such as a cough, or if you're just not feeling well. So really, we want to ensure the main thing that you can do to help us overall is to really try to social distance yourself as much as possible, but stay as healthy and well, not just physically, but also mentally. And I do encourage the use of all the wonderful progressive activities that WomenHeart is encouraging right now through the virtual support group. I really am so excited for my ladies in Arizona in April to start this. They're so excited. We have a series of patients that are also very interested in this. So really take advantage of all the support that WomenHeart is providing, including webinars like this, which hopefully was very informative for you. Another question from Evan is, will this video be available to give to our support group members? Yes.
Yes, yes. The answer is yes. Before you all go on to the next thing you're going to do, I just want to say a big thank you to Dr. Bond. Thank you so much. That was a fire, what do you call it? A fire round of questions. Thank you for doing that. Yes, I want to emphasize and repeat that this video will be loaded up to Champion Connect and through our social media channels as soon as we can. But if this was informative to you, please let us know that. We'd love to get that feedback. If there are other types of speakers and other topics you want to hear, please let us know as well. This is something that we hope to continue on throughout this period. And I would just encourage you to let your friends know about it so that we can see even more of you online. Thank you very much. Stay safe, stay well, and social distance. Bye-bye.
Bye.